Diagnostic arthroscopy of the right shoulder. So this is a pretty good one. So we've established our portal here through the front. This is rotator interval, sort of in this triangle here, which is created by the long-headed biceps tendon right there. And then the superior fibers of subscapularis, which you can see right here. Those are both looking pretty normal. So coming into the joint here, so this is the glenoid, that's the humeral head. If we look directly up, that is the rotator cuff. That's what a normal rotator cuff looks like. Good attachment there onto the humerus. If we slowly look around, that's infraspinatus, then coming down to the back teres minor. And then if we slip all the way down into the inferior axillary recess, that's the inferior glenohumeral ligament, also looks good. Coming back up into the joint, that's the inferior labrum. So there you can see a normal attachment right there between the labrum and the glenoid cartilage. So you can't really tell where the labrum stops and the cartilage begins, other than sort of looks like a small little wave or bump there. But as you come superior, where this long-headed biceps attaches here, this is a slap tear. So this is superior labrum, anterior to posterior, SLAP. And this is a slap tear of the shoulder. And as you can see, when you use your bicep, it stretches this tendon and it pulls on this torn tissue here, which is the superior labrum, and that's where the symptoms come from in this condition. The rest of the labrum looks pretty good, so we can sort of follow it all the way around the back. There's the posterior labrum, that's the inferior labrum, and then if we push through the front here, you can see the anterior labrum that comes around the top, and it attaches right there. So this is a superior labral tear. Because of this patient's age, we're going to release the long-headed biceps tendon and then convert it into a subpectoral biceps tenodesis, which is going to get rid of all of her symptoms, restore full function of the shoulder and the arm, and get her back to 100% in a pretty quick recovery. Okay, so here's our radiofrequency ablator coming in here. It allows me just to trim this down, make it look good. It also allows us to release the long-headed biceps, which we'll do right there. And there you can see last little strands remaining. I'm going to let those go, and boom, the biceps is out. We'll just debride and just make this look pretty. And that's it. That looks better. We're going to reattach the bicep now, and that's it for the slap.